ladies and gentlemen, welcome to my channel. My name is Claire. On this channel we talk about motherhood and living with HIV. So in this video series I'm sharing my experience as a woman living with HIV who was born with HIV. I'm 40 and I'm pregnant. And I'm not a doctor, I'm not a social worker or a nurse. I'm just a mom. This is my third pregnancy, so I'm sharing from my experiences. And I hope other women who are living with HIV, who are pregnant or who are planning to be pregnant, can learn something from these videos. In today's video, I'm going to talk about the symptoms I'm having now. As I shared in the other video, I'm coming off from my ultrasound. I was able to see my baby. Everything is going fine, and my healthcare providers are cheering me up. They're saying, girl, you can do this, you got this. So in today's video, I'm going to share my symptoms, how I'm feeling, the symptoms, pregnancy symptoms. The first one is pee. Oh my God, even when I sneeze, I pee. When I yell at baby Aaron, I pee. Pee, 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 pee. The urge to pee is high. And I know now why, because this baby is sitting on my bladder. So, making me feel like I want to pee all the time. And what I use Depend. So these are adult underwear, which you can use once, but they're really nice. They make me feel confident. Whenever I sneeze, I want to pee. These are amazing. And also I use them even after having a baby. Instead of wearing 24 diapers or pad, I just use the Depend and change them often. They're so helpful. And sometimes I have contraction, I have spotting, and my doctor told me to all the time to show up at the ER when it happened, because it can be something small and it can be something big. And something I have noticed that is this baby is able to listen. Whenever I yell at baby Aaron, the baby jumps. So really my apartment must be getting old, so there's no window, so the baby can hear me yelling at baby Aaron. And when I'm singing, also the baby kicks. But when I'm yelling at baby Aaron, the baby kicks with so much energies. And another symptoms I'm having is a back pain. And it's normal because I'm overweight. I'm not ashamed to say that, because I need to work on making sure my weight is healthy. But right now my body is carrying too much. So for my back pain, I'm taking aspirin 81. If you are a woman living with HIV and you're pregnant, talk to your healthcare provider, because they recommend that you don't use other type of pain relief. Check with your healthcare providers which type of pain relief you can take. And another difficulty I'm having is sleeping position. Normally I'm a person who sleeps on my belly, but now I can sleep on my tummy because the bump is already there. So I feel like I'm swimming if I try to sleep on my tummy, and it's not healthy for me and for the baby. I can't sleep on my back because, again, it's not good to sleep on your back when you're pregnant, especially in the second trimester. Sleeping on our back can reduce the blood flow to the baby and to my heart. So that's a no. So I have to sleep on my side, and still I feel unbalanced because there's a tummy in the way. Also, I lose balance when I get off the couch. Normally, my grandfather always told me not to be worried that I'm the shortest in my family. I come from a family where people are tall, and I'm very short. So my grandfather always told me, Claire, don't worry. You short women live longer. Short women never lose balance and never bend their back. And so you will be young in your 80s. And with this pregnancy, I feel like I don't have balance when I'm getting off. It takes me like 2 to 5 minutes to get the balance because I feel I'm losing balance. So this is a reminder that I have to do more exercise. So my growing bones are used to the growing baby inside me, and I'm able to be straight when I'm walking. Also, I'm having a lot of appetite. From the first trimester to the second trimester, I really like to eat. So I will be sharing with you what I eat in a week. Because this baby needs to grow and mommy needs to stay healthy. So another symptoms, I'm having vivid dreams. This week I had a dream and President Bush visited me in Michigan, in Metro Detroit. He came to my house with no security, nothing. He just showed up speaking like this voice. Oh, Claire, I signed that bill that allowed the developing country to get antiretroviral treatment. And I'm so proud of you that I can see with my eyes one of the people I have impacted. And he was sitting in my living room. We had fun. We talked. Baby Aaron came and gave him a hug. There was no security, nothing. It was just President Bush. And then he said, Claire, I'm a painter right now. Now, we both are artists. And I heard you got a big award for being an artist. Let me tell you something. I'm an artist too. So I woke up, I was like, what a strange dream. How President Bush, the Bush the son, not Bush the father, President W. Bush the son, the youngest Bush, not the father, can come and visit me. When we are pregnant, we have strange dreams. Also, I have noticed a sign from the universe. Really, if we pay attention, we don't run all the time. We're not busy with our social media feed. There's stuff we can observe. These are my observations. The nature is sending me messages. I have a bird nest just at the front door, and I have a family of bunnies that have dug a hole in the backyard, and they come with their babies. They're like tiny babies. So I see all kind of nature showing me they're having children, and I have been able to see the squirrels in my backyard with small squirrels of babies. And before, I used to go out and the birds, they fly away, or they run away. But this time I go and sit down and they come close to me. So for me, it's a sign of pregnancy where the universe really come together and say, yeah, we are creating life. So these have been my symptoms in the second trimester. Subscribe, follow me, and I'll be giving you update.